Thanks so much for joining me on the podcast. How are you today?
I'm great. Thanks. How you doing?
I'm doing well. I'm excited for this conversation. You have a unique background, and you've been someone I've wanted to have on in the past. I'm surprised it wasn't like, I don't want to put it out there like I was trying to reach out and you weren't responding. That was not the case at all. It just did not align, and now it finally did. So I'm glad we're finally having you on the podcast. Would love to kind of kick things off because you really have a unique journey, from being a clinician to really being a hit on YouTube to impacting healthcare staffing. What led you back to healthcare though, and why did you decide to tackle the inefficiencies in dental practices specifically?
Sure. Yeah. No, it's great to be on here. I'm glad this worked out. Thanks for having me. Um, yeah, I mean, I have had an eclectic background. I've always sort of followed my passions, and after the YouTube thing and then the media business that I built, I was, really excited to kind of help out an industry that I had initially trained in. I had friends who were doctors who complained a lot about the inefficiencies in healthcare. So that's kind of what broadly got me in, kind of back into the healthcare space. And then dental specifically, after selling Silver Sheet, which was the credentialing SaaS business, Steve, my co-founder, and I really were just thinking about areas where there was opportunities for improvement. We both had a bunch of sort of negative personal experiences in the dental industry. There's a lot of great clinicians, but like the healthcare system, the dental system also has its issues. And we really felt like there was room for improvement.
It's I just had on the other end of it for another one of our shows, the CEO of Incredible Health and what she's doing on the what Iman's doing on the um, nursing side of things, but still similar issues around like these shortages are impacting these industries, and in this case dental, and the administrative burdens that are created. So can you walk us through how your AI coworkers kind of work and what they're doing to kind of change the game for these dental offices?
Yeah, for sure. Yeah, and I mean, you're absolutely right. There's staffing issues across healthcare. In dental, 75% of practices are dealing with staffing problems. Like one of the number one complaint that we got with practices that we've worked with over the last couple of years has been staffing issues, particularly front desk, but staffing in general. Um, and it's a societal trend, right? There is an increasing need, obviously, with the boomer generation for both health and dental care. And simultaneously, the staff that works in these settings need to be trained, oftentimes have licensing requirements. And so the supply of available staff is just going to be lower because there's a training period and there's a bar required. Um, and so, we got really excited about AI over the last year and a half. And, things are moving so quickly. We actually looked into building a voice agent about a year ago, and the technology wasn't there. It just simply wasn't good enough. And really, in the last 6 months, it became viable. And so, the way we really look at it with Fiona, who's our first AI, is these are really coworkers that can help the staff that works at the dental clinic do their job better and, frankly, focus on clinical care, or in the case of Fiona, focus on in-office interactions and allow her to handle the calls that are coming in.
I don't know if anyone on your team has done this yet, but you're going to need to do some clip from Shrek where they say Fiona in the way that they say it, because as soon as you say that name, I get, yeah, I love the name. First off, I love the name of the company that you selected. I love the name of, this AI coworker that you've created. And, when we think about leveraging AI in these practices, like you're implementing, one can't help but think that, and I think you've said this somewhere in the past. This is not my own thought. This is something I believe I read that you said, but everything could disappear in the future, but the clinician. What exactly does that mean to you, and what role do you see? Like, okay, here's where you're at now with AI and impacting dental teams. How do you see that continuing to shape the future of these dental teams over time?
Yeah, I mean, there's a general like dialogue in the tech community broadly around, when will we see the first unicorn company with one person that works there, right? Just the founder. And I think that's sort of, an extreme view. I don't think that that's happening today or probably for a while, but I do think that it's generally directionally correct, and I think it's directionally correct across industries, including dental, where with smaller teams, leaner teams, more focused teams, you can get a lot more done. I think that for dental and other industries where you are physically present and you have to physically interact with other individuals, it's less, disruptible or less impacted by AI. Although, the advancements in robotics are going pretty fast as well. So I think that we are going to see changes there, maybe as a fast follow to just software AI. So I think that's kind of how I think about it. And frankly, for an industry like dental or an industry like healthcare more broadly, um, hiring staff is hard. There are staffing shortages. So I think realistically, you still see full employment. You just see like better customer service, better care for patients because you can reallocate resources towards the clinical side.
And I would love if you don't mind, like if possible, if you could share any specific success story that you've currently had with a practice that's leveraged Flossy. If not, totally fine too. But would love to give you that moment as well, if possible.
Sure. Yeah. I mean, I can talk a little bit about a pediatric practice that we work with. I mean, people are using Fiona in a few different capacities. So, she is an AI voice agent. She is an AI receptionist. So you can call a dental practice, you talk to Fiona. She can book your appointment. She can reschedule your appointment. She can cancel your appointment. She can answer questions about the appointment that you have coming up. She can actually answer clinical questions about the dental issue that you have. Obviously, it's not like from a dentist or official, but she's actually passed the dental board, so she knows like a ton about dental care. And the language model, the voice model is extremely good. It is very hard to tell that you are not talking to a human. At this point, really with the technology, the only giveaway is there's a slight amount of latency in the responsiveness, but I would estimate in the next 6 months that'll be gone. And so kind of that's the framework. And so practices like this pediatric practice, they're using Fiona for after hours and overflow coverage. So, what you find is that when these practices are closed, the calls are literally just going to voicemail. And typically that is if it's a patient, new patient, that's a dead lead that is going nowhere because that patient is either calling another practice or they're going to figure out somehow how they're going to get their care taken care of. And then also for overflow. So surprisingly, during the day, the front office staff, they're often doing many different things. They're not just a receptionist. In fact, sometimes they're a dental tech that's like doing double duty at the front desk that actually could even be seeing patients. And so depends on the practice, but anywhere from 30 to even 50% of calls are actually missed during the day. And so for this practice that we're working with, they now have an AI receptionist that can answer an infinite amount of calls. 100% of the calls are answered, and patients are being booked, reschedulings are happening, calendars are cleaner. It's a dramatically better experience.
Now, I could see this for smaller dental practices being a big deal, even for the larger DSOs. But let's also talk about from the smaller dental practice side of things. It sounds like this will even the playing field a little bit, right? Level that up. Do you see that as well? And um, maybe I mean there's some obvious things based on what you just said and to why that is. But if you want to add anything to that, I would love to hear that.
Yeah, no. Yeah, for sure. I mean, so we're talking to DSOs. We have, like tons of DSO relationships over the years. There's an obvious fit there. Many of them already have the larger ones like centralized call operations. And so, they're always looking for efficiency. But for sure, for small practices, I mean, one of the things that we kind of realized looking across the dental industry is that dentists really want platforms and not point solutions. It's very hard as a non-technical person in a non-technical industry to be able to take a bunch of different pieces of software and like stitch it together in a way that's going to work and work effectively. I mean, it's hard for a tech company like us to take HubSpot and match it up with all of our other software. So, so I think that for smaller practices, number one, Fiona is giving them like superpowers that really you would only get if you have a call center operation, if you're offshoring. And in fact, it's better than that because she's 1/10 the cost of a human employee and she's perfect every time. And number two, we're building out a suite of agents that all will work together. So, we're building an agent that will do insurance verification and help with getting payments back from insurance companies for dentists that will literally call the insurance company for you to try to get the payments. We're building out an AI that will handle kind of like business intelligence and help you run your practice better. And then, yeah, so those are kind of like our main focuses. And, these agents will all work together in sort of a seamless platform. And we really think of them and we want our customers to think of them as employees. So we have like a feature where you can give Fiona a one-on-one and you're literally chatting with her or talking with her. And that feedback directly affects the underlying model that changes her behavior going forward.
That's when it starts getting super interesting because that's beyond anything like uh, beyond any of those old tools that we've had in the past, right? Where you could
Correct.
talk with some messaging machine when it's actually able to, in a way, think, right? Because it's actually
Yeah.
taking what you're saying and then changing the output as a result of that. That's huge. I also like how you mentioned earlier how you're like it's past the dental exam, so like it's very knowledgeable in this space, and that makes I mean that makes total sense. So in many cases, the person talking with that agent is actually talking with someone that's more knowledgeable than anyone else
Oh,
that would have been answering the phone.
100%. I mean, beyond having the inherent clinical knowledge from our broader system, it also has specific knowledge about that practice. So we have like an FAQ that we put together with the practice that gets loaded into the model. And so it knows all the information about, simple things like the hours the practice is open, but also when is one dentist there versus another dentist there. It also knows all the scheduling rules for that practice for different dentists. So yeah, absolutely.
Now, with AI handling so many of these office tasks now, do you see any new opportunities opening up for dentists and hygienists that maybe they couldn't have even touched before? Do you see more flexible work models? Like, take me through your thought process here.
Yeah, I think it's interesting. I mean, if you think about all the back office stuff, even front office, and you could imagine like, an iPad at the check-in if you really wanted to, where people could check in. We're actually launching a product like that. I think you'll probably have somebody sitting at the front desk. One of the analogies that I use is, pilots on commercial airlines. So like, it's not like totally common knowledge, but a lot of people know this, but airplanes can completely fly themselves. Like pilots are not necessary at all. They can take off, they can fly, they can land. And in fact, if you look at most recent air disasters, it's a situation where the AI was trying to do something, the pilot overruled it, and then a crash occurred, which is kind of crazy. And this is actually a broad conversation in AI in general, which is like, do you do the elevator model or do you do the airplane model, right? Like the airplane model is there's a pilot, there's a co-pilot, there's automated systems. Technically, they can overrule it, but sometimes that causes problems. An elevator, there's no one. It just does its thing, right? And I think the answer is it we'll see, and it's going to depend on the interest industry, and it's very dependent upon human comfort levels, right? Like we would be very uncomfortable if there was no pilot or co-pilot in that airplane. So anyway, I say that because in dental and I think in healthcare, it's kind of like airlines in the sense that like I think even if the AI could fully do everything, including there's a robot that's then there's companies that have actually raised money over the last year to do sort of robotics for dental. And in healthcare, there's AI almost like fully robotic surgeries, like urology has used it extensively, et cetera. But anyway, even with that, I think you still have the clinician, right? Like, number one, I don't think people are going to be comfortable for a very, 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 very long time, if ever. And I think from a regulatory standpoint, like there's just no way. So I think that what I kind of envision is you still have clinical staff, you still have a team, but I think the opportunity is just better, more personal clinical care, right? It's like the old model of like your neighborhood doctor that like knows you, and even they did a house visit. And so I think there's opportunities like that. There could be more opportunities for mobile dental. There has been some of that already, or like dental clinics that will set up at employers and do dental visits, or at schools. I think for public health, there's a big opportunity because by lowering the cost of care, and in particular, the cost of a preventative care, I think that you could really hit a broader swath of the population. So I see a lot of opportunities there.
Yeah, I mean, the mobile dentistry piece makes so much sense to me, especially when you talk about some of these large company. Like, would it be that big of a deal to let them set up shop in a big company and see patients over the course of like a day or two, where these people are probably going to be taking time off to go for their dental appointments anyhow, and just work it as part of the time they're in the office? It makes total sense. It's you know, and some people might laugh at that, but like we're starting to see it with barbers. We're starting to see it with all these other, let me go to where you are to make the friction as little as possible that you're actually going to do it. Um, saw something. This was, I think, last year. I don't know how they're doing. I'll have to check in on it. But like, someone said, you know how much time people spend in these laundromats, so they set up clinics in the laundromats because they're like usually people are going once or twice a week if you go to a laundromat.
That's smart.
So yeah, it's I could see mobile dentistry and obviously like solutions what you're doing that just further helps those opportunities. Um, I would love to hear, because you've kind of been on all ends of healthcare now. And I just want to quickly add too, I've been doing a lot more on like the episodes on dental and medical integration and what that looks like, and it's been super interesting topics. I had someone from CareQuest to come on and talk about that through their Smile program. Henry Shine One came on and talked about that as well. What lessons from Flossy's AI implementation could translate to other areas like maybe primary care or specialty clinics?
Yeah, for sure. I mean, so I think dental is a great proving ground. We've been in dental for a bit, and these AI tools are sort of the latest like things that we've launched. So we know the industry super well. It's a bit more constrained from a scope and sort of clinical complexity standpoint. Obviously, like there's like 800 CDT codes versus thousands of CPT codes in healthcare. So that, and it's a bit more of a fee for service model, basically. But I think, like, from a pure technology standpoint, I think that it's very applicable. Like, definitely the clinical knowledge, that's different, and we'd have to train the model for that. But, it's doable. The specific practice knowledge is obviously going to be different, but a lot of the stuff is similar. And, really, we found that about 80% of the calls that come in are scheduling related. So they're either scheduling a new visit or rescheduling. And scheduling is a generic challenge, right? Like the issues around scheduling and dealing with calendar systems and the back and forth is kind of across industries. So I think it's very applicable. Right now, we're super focused on dental, and as I kind of laid out, we're building out a suite of products for dental, but I think a lot of those even could be applicable to other types of practices as well.
So as we look forward, talk me through where you see the future of Flossy heading with what you can share today and what really excites you about that future.
Yeah, sure. I mean, like I said, I think over a 6 to 12 month timeline, Fiona is perfect and can handle effectively every type of a call, barring the most complex edge case that is very, like very, very uncommon. Like 99.9% of all incoming calls are perfectly handled by Fiona. I think that we will have, more of our AI agents live. Like certainly this year, we're planning on launching at least another one, maybe more. this is another trend that's going on, which is software development is being exceedingly impacted by AI. We use Cursor internally, which is a software development AI tool that makes our engineers more efficient. And there's other tools that are launching every day, and those models are getting better. So it's pretty crazy. I mean, we went from idea to production product in 45 days, which is kind of unheard of. Now we had prior experience and we had been looking into this stuff, but like from this specific product. And I just think, I think over a 3-year time period, there will be agents across dental practices from us, from other companies that are doing the non-clinical work. So whether that's receptionist, business intelligence and practice management, insurance verification, marketing automation, that's another AI we've been looking into, and media spend management. And I think that over a 5 to 10-year window, there's clinical augmentation through robotics that probably looks a lot like urology and radiology, which are fields which already have been heavily impacted, but you still see the clinicians. And I think that in dental, the model will be the same as it has been in medical and in airlines and things like that, where the human is still part of the loop. And then I think for us, I think it's possible we're beyond the dental vertical and we're in healthcare more broadly.
I like that you put the disclaimer, by the way, of, we did this in 45 days, but we also have prior experience. There needs to be that disclaimer on there because
Sure, yeah.
This is you. This is not your first rodeo. I'm sure it would have taken first-time founder Miles, right? Longer than that. But that also speaks
Oh
to the
yeah.
technology, though, too, right?
First time founder Miles, we tried to build something 10 times bigger than we should have bit off. And then we spent literally 2 years digging ourselves out of technical debt. I would go to meetings with celebrities and we would show them our glorious software product that we had built to run their website. And it would literally throw an error on the screen. And I would have to click back and explain it away. So for sure, doing multiple companies helps. Knowing dental for a few years now helps. We had a huge data set. So because we still actually match patients with dentists for clinical visits on the consumer side, and we have 100,000 or so data points from clinical encounters. So all of that was obviously critical, but the actual from this product, yeah, I mean it's pretty quick.
That's funny. I want to thank you so much for joining me here today. Hopefully, we can have you come on in the near future, talk through some other topics. Hopefully I run into you at one of these conferences at some point as well. But thanks so much for joining us here today and look forward to future chats.
For sure. Yeah. Thanks a lot for having me. I really appreciate it.